So good afternoon, last session of the day. So please be patient, and after this session, we're going to invite you to the cocktail. So, so I will invite you to maybe to sit here because we have like a couple of slides that I think are very interesting to you to see while our fellow panelists will explain. Okay. So thank you so much for this session. On behalf of the Pan American Health Organization, Regional Office for the Americas of the World Health Organization, I welcome you to this session. My name is Daniel Rodriguez, and I'm the Director of Procurement and Supply Management. So I want to welcome our fellow panelists. So we are honored to have here the honored Parliamentary Secretary Ken Edwards from the Minister of Health and Wellness of the Commonwealth of Dominica. So thank you for joining us. But also two important partners which are helping us to establish our strategies on sustainability and logistics optimization. So I want to welcome Karsten Hansen, who is the Director of Sourcing House. Sourcing House is an organization specialized on helping companies, organizations to establish sustainable supply chain and procurement strategies. And Karsten is well known in the UN system. He has over 20 years of experience in the UN world with senior leadership roles in the procurement field. So the last position, he was the Global Procurement Service Director for UNDP. So we welcome Karsten. And we also have Nelson Merino, but also Enrique Romero from Decisiones Logísticas, which is an organization in Colombia specialized in logistics optimization. So they do the magic of analyzing data, doing the scenarios, simulations, so on. So we are happy to have this panel where we are going to discuss about the challenges, but also the solutions, practical solutions to make health supply chains more sustainable, so decarbonize those logistics in our supply chains, but also how to make them with lower cost. Okay. So just briefly about PAHO, the Pan American Health Organization, is a member state-driven organization focused on public health. So member states include all the Americas and are represented by the ministers of health. So they are the ones telling us what to do. They are the ones setting the regional goals on public health, and we are the ones providing support to eliminate disease, to control non-communicable disease, and part of this cooperation involves important procurement and supply chain activities. So the PAHO has very important reach. So over 40 million people in the Americas are protected every year with vaccines procured through the PAHO Regional Revolving Funds, which is a pool procurement mechanism. But not only on vaccinations, 8 of 10 babies born in the region are protected with vaccines procured through PAHO. But also we have we enable support to 500,000 people with TB, with tuberculosis, to receive treatment, and 450,000 people get their first line of treatment for HIV. So it has an important reach in the region. And this is thanks to the PAHO Regional Revolving Funds. So what are these regional revolving funds? We have two. The first one is the Revolving Fund for Access to Vaccines, which was established 40 years ago to support member states to eliminate vaccine preventable disease. So we have eliminate polio, measles, and we have quickly include vaccines in our public health programs across the region. So remarkable achievements securing low prices and quality vaccines in a timely supply fashion. The other mechanism is the strategic fund, which was created 25 years ago and is focused on diagnostics and treatments. So our approach is to pull the demand from 41 countries and territories in the Americas, including the the Caribbean. So, for example, Barbados, all the vaccines used in the immunization program are procured through this mechanism, as well as Dominica and other 17 nations, territories in the region. So it has an important approach here. So what we do is to pull the demand, we do the whole procurement and logistics operations on behalf of the member states, and we achieve those three main objectives that I already told. One is timely delivery, second is quality, and third is low prices. So the governments can sustain with their own budgets the public health programs. But we have challenges. We have three main challenges here. So over 93% of the volume that we procure comes from overseas. Right? So we have to, most of the volume comes from India, then Korea, Europe. So that poses challenges because you have to fly vaccines from all over the world with high emissions, with high costs, with chances to miss connections. And we are talking about cold-sensitive products. So this is the first challenge. The second challenge is that we have destinations really hard to reach out. For example, the seeds, because of the low connectivity, and also landlocked countries such as Bolivia and Paraguay. Last year, we managed almost 3,000 shipments, mostly by air of vaccines and all these products we procure on behalf of the governments. But the third most important challenge, and we as a public health organization, we are aware about the impact of climate change to disease, to health. So right now, about half of the world's population is on risk of dengue. So 20 years ago, we accounted in the world 500,000 cases of dengue every year. This year, we are reaching to 5 million cases. And we are seeing dengue, the mosquito, we are seeing that mosquito transmitting this disease in south of Chile, in Uruguay, where we will never saw dengue in the past. So this is one of the difficult challenges that we're facing now in health. The other one is on the emergencies, like the environmental emergencies, such as in the Caribbean with the hurricanes. 3 weeks ago in Rio Grande do Sul, the flooding, which has displaced 500,000 people. And we are on the risk of emerging diseases such as hepatitis and meningitis. Actually, we are procuring vaccines to support that emergency. So this is why we are reviewing our logistics, and we want to share with you what are those challenges, but also the practical solutions. So just to finalize and to start the panel, we commit with sustainability because member states in the world, WHO member states, are aware of how emissions are linked to climate change. So there's an initiative called ATTACH, which is the Alliance for Transformative Action on Climate and Health. So the goal here is for member states to establish baselines of emissions of their health systems and have actions to reduce those emissions. Actually, between 4 to 10% of emissions from a country are related to the health systems. And we as PAHO, as an arm of those health systems, we are committed to walk the talk, to have to be part of this commitment from member states to reduce emissions. The second one, last year in July, we have a meeting in Panama with all the immunization program managers, and they were concerned about the prices of freight they were paying from the Caribbean mostly. They say, we are paying 60 cents for a syringe, but $1 per syringe in freight charges. So that means every dollar we spend more in logistics is $1 less in buying health technologies, diagnostics, other priorities. So that's a big concern from mostly from the member state from the Caribbean. So that's why, because of the ATTACH and also the concerns on logistics, we partnered with Sourcing House and Decisiones Logísticas to set concrete, sustainable strategy for the emissions in our logistics, following global standards such as the Greenhouse Gas Protocol, but also in the logistics to review our whole our whole operation and provide us concrete solutions to decarbonize, but at the same time provide savings to our member states on the logistics. So thank you for joining us, and I would like to start with the Honorable Edwards to share with the audience what are your challenges from Dominica and the Caribbean to receive vaccines and medicines. Just
thank you.
Microphone.
And thanks for inviting me here. I'm from Dominica, as you know. My name is Honorable Ken Edwards, and we have been having our vaccination program in Dominica for a very long time because, as we all know, Dominica has a very robust vaccine program and primary health care program, and we need to get that vaccine into the villages, into the towns, so we could get it administered. And let me thank PAHO, and we are very grateful for your revolving fund that has made that happen for well over 2 decades. We have issues, obviously, with our logistics in getting these vaccines into Dominica. And packaging, proper packaging is one of the issues that we confront with on a regular basis because it comes from so far. And the airports and the port in Dominica is very small. The planes carrying it get cramped up among other cargoes. And sometimes because of the styrofoam material that it is packaged in, it gets damaged in the process. And Dominica does not have direct flights. If any, very few. And as my friend just said earlier on, these vaccines come from very far. So it can't come to Dominica directly. It must be placed somewhere before it is initially and then sent to Dominica. And that's a major problem. And even so, there is no cold storage facility at the airport in Dominica. Unlike other sister islands, like Antigua, for example, there's a cold storage facility. So when that affects the cold chain, obviously, and quality. And when it arrives in Dominica, most times it is sent to Portsmouth, which is another town in the north of the island, like 20 or 30 to 25 miles away from Roseau. It stays there and it is sent back into town. And when it reaches there, it has to be processed. And in that time, we find ourselves having to be struggling to have it sent to us. And I remember recently, like last month in April, we had to discard a good load of vaccines because there was a flight delay, and that affected the vaccine so badly. The cold chain was damaged, it got hot, we had to discard it. So we know because of that connectivity and our lack of air transport, and most of our cargo, well, our vaccines are mostly via the air transport. That's an issue for us. And we are working on it because an airport is being built, but it is not going to be completed very soon. So we still have to deal with this issue in the meantime. And because of the fact that we have to be transporting these vaccines via air, it is much more costly than if it was done via ocean. And we spend quite a lot of money in transporting this vaccine, money that could have been spent otherwise. And we could have used this money buying other vaccines to help other ailments. So this is also an issue. And we also need to be on par to track the vaccines, to track it, to know exactly where it is. So we did an electronic system to track it. So we could track the vaccines and follow the shipment and follow where it is. So we could immediately dispatch our drivers and our people to pick it up as soon. But that does not happen. Sometimes we have, it is on its way, but we have no idea where it is. We have no tracking system. We have no information coming to us as to what area. And then like midnight or 10 at night or early morning, you just get a call. There are some vaccines at the airport. You have to rush to get the transport to try to get it quickly because, like I said, there is no cold chain, no cold storage facility at the airport. So we have issues with logistics. And for now, I will end there, but I will come back later.
Well, thank you so much. And there's a saying that in order to understanding the problem is halfway to have the solution. And this is what we are doing with the Decisiones Logísticas. So, Enrique, you analyze with the team the 2023 data, right? The origin, destinations, mode of transportation, all the data. So what are the insights did you find?
Well, thank you for giving us the opportunity to share with everyone our ideas, our findings in this study we already made. And of course, there is some elements you already addressed before, such as the location of the suppliers. But in order to show you, to highlight you with the insights we already found, let me show you an example. Let's take the pentavalent vaccine, which is widely used in the whole region. So if you see the chart, serving the Caribbean region, practically speaking, is 3 times higher than South America. And we are talking about the same vaccine. We are not talking about different products. We're talking about the same thing, okay? What is so? Let me give you some elements for understanding better what is happening in this situation with the Caribbean. If you are a pharmaceutical lab, what is better for you? Getting many shipments with low quantities over a year, or getting just few shipments with higher quantities in the same period? I think the question is pretty easy to answer, right? So that is what's happening. Around 96% of the shipments to the Caribbean, had less than 5 tons. That means, on 2023, the Caribbean region handled very few shipments with higher quantities and widespread among the year. That's a big challenge. Practically speaking, the only way to handle this is on a one-to-one basis. It's a one-to-one logistics. And that means it's costly, which is the opposite behavior in South America. South America has higher quantities, fewer treatments, so it's possible to do a quite interesting optimization logistics element. Keep in mind the following things: consolidation and volume. This is critical. But there is an additional element that we need to take into account. Around 98% of the shipments in 2023 were made by air. So the logistics in the region is quite air intensive, which is also costly as well, okay? There is another challenge there that we need to take into account, and we need to face and come up with some solutions to that fact. Thank you.
No, and that's an important insight. So we have found that we are flying syringes, right?
Yeah.
A syringe which is bulky, it doesn't make sense, which shelf life of 5 years. So we have found those opportunities to improve, to move by ocean. But no, thanks for the insights. And Carsten, you have heard the challenges on logistics. How this is connected with sustainability?
Yeah, thank you. Thank you, PAHO, for inviting us to this panel and for this discussion today. So we heard a lot about the last 2 days about supply chain, logistics, and sustainability, right? We have a bit of forum fatigue, perhaps. But the linkage is perhaps not obvious. And when we try to look at the how to deal with sustainability, how to implement sustainability integration strategies, we need to break it down a bit. Now, first, of course, just going back to shipping. So we've heard a lot that shipping represents 80% of the global logistics activities and representing 3% of global GHG. But the overall freight transportation and logistics activities is more around 8 to 10%, meaning that all modes of transportations are not equal. So we need to look into that. We're also looking at a transportation sector that is going to double by 2050. However, the demand for freight transport is expected to triple. So with this kind of expected growth, we really need to take action. There's a demand for action, and there's demand for action around consolidation, collaboration, standardization, pursuing low-emission technology solutions, which is what we'll talk about today. But I really think to really get the insight into how you can go from the why we should do it to how we're going to reduce our emissions footprint, we really need to go back to how we calculate emissions in the first place. Really look at the calculation equation. So when we calculate GHG emission, it's quite simple. We look at the activity, which is the distance and the weight of the logistics activity, times the emission factor. So here, distance is a factor. So we heard yesterday about the Red Sea, the Panama Canal disruption, et cetera, which led to further distances traveled, which leads automatically, of course, and intuitively to higher GHG emissions because the ships burn more fuel, they have to travel more distances. That's logical. Now, the other factor here is weight. So weight is a factor in GHG. So if you are able to reduce, let's say, the packaging or the weight of the product itself, you can reduce your GHG footprint. The last factor, of course, the most important, is the emission factor. What is the mode of transportation? So if you sail it by ship, it will be a factor, let's say, 1 to 10 of if you ship it by air, if not more, depending. Now, each of these modes of transportation have hundreds, if not thousands, of breakdowns, depending on what kind of fuel types, et cetera. If you're traveling by truck, there's some averages, but you can go down to, I'm driving a truck from Volvo 1979, has a certain fuel emission factor versus others. And once you break it down into these subcomponents, you can start developing meaningful strategies about how you're going to reduce your emissions. And this is what PAHO has been doing in their strategies, which we're going to talk about. We also need to look at the different transportation chain elements, the TCs as we call them. There's the inland transportation from the point of manufacturing to the nearest port. That is usually an inland transportation. You have the option of sending it by rail, by truck, by inland waterways. In India, 60% of the railways are electrified, which has an impact on the footprint there. You can ask your suppliers to electrify their fleet. This will have an impact on your GHG. You can have them train the drivers in GHG, low emission driving, meaning they drive slower, they brake less, they are more aware of their fuel consumption, etc. The next one is the port hubs themselves. There was a great session this morning talking about hubs, the port hubs themselves, how they can facilitate emission reduction in the supply chain. And then we have what we calculate to be the biggest GHG heavy component, which is the transportation from the port of origin to the port of destination, in this case for PAHO, often from, let's say, India, South Korea, Europe, to any point here in South America and the Caribbean. So this represented 95% of the emissions footprint. And then when it lands, there's another port component, of course, at the point of destination, and then the inland last mile distribution, which you need to calculate. So this is the linkage, and I think it's just so important that we break it down into its subcomponents. We understand what these factors represent, but each factor is an opportunity. It's an opportunity for minimizing and lowering your emissions, whether you're reducing distance, you're reducing weight, or you're reducing the emission factor. So that's the direct linkage between the logistics activities, how you strategize, how you optimize your strategy, and that of your sustainability or emissions footprint in this case. Thank you.
Thank you, Carsten. So, yeah, clear link between emissions and modes of transportation. So, Enrique, what strategies would you recommend? You know, we're transitioning now to these solutions, practical solutions. So, based on the data, based on the challenges, and just to give a perspective to everyone, right now, or as of today, we have been managing order or one shipment by one shipment. For example, Dominica could be requesting one vaccine on Monday, then 3 days later, we place the order for Barbados. So we are not, I think, managing the logistics in a smart way. So what are the strategies that would you recommend to reduce cost and emissions?
I want to give you a clear message. One strategy doesn't fit all, and that must be understanding clearly. You know, there is no way we can handle one strategy, you know, for managing the whole region. LATAM is different. You know, South America is different from Central America, from the Caribbean, when we're talking about logistics. It's not the same thing. So we come up with some different ideas, but in order to understand that, I'm highly recommended to see the logistics in a different way, not as we're seeing so far, let's say, to handle just in a reactive way. We need to be more proactive. And that's why our solution is try to somehow find out the way to do that in a better way, in a fastest way indeed. For instance, there's an interesting opportunity for doing consolidation. even at origin. In India, there's a bigger pharmaceutical labs that manufactures vaccines, and there's an interesting opportunity to do a consolidation at origin, that also brings interesting optimization, cost reduction if we can achieve this kind of strategies. But also we can do the same in Europe. We can use a freight forwarder also to consolidate the products at origin. But before doing that, we also need to consolidate the procurement, which is critical. Managing orders one by one, as Daniel mentioned it previously, lets the path to failure. There is no way you can optimize logistics if you are not able to change the way you are placing orders. And that's quite important. Remember, again, the key points from logistics optimization: volume and consolidation. If we can achieve this, we can optimize logistics. I know it sounds easy. Of course, it's not as easy as it sounds. Of course not. But we need to find a way to do that. So the first element is this: take advantage from the consolidation. There are opportunities there, okay? But also another idea, to handle other products as well, is considering the situation of adding a hub into the region. Could be a regional hub, could be a hub located in Panama, Miami, even here in Barbados, that can serve the Caribbean market. That leads to lead time reduction, which is and service level increasing trend, which is also helpful for the region and can let the region to access to products, to medicines that they are not accessing right away. So, of course, operating a hub means new costs, arise new challenges as well, because somebody, should handle it. The governance model of it should be adapted somehow, but also can create an interesting opportunity to consolidate the achievements. Again, we're solving a little bit, these challenges we already mentioned previously. For instance, we can pre-positioning, some inventory in the hub. For example, syringes, can be put in that hub and also create an interesting opportunity for delivery faster, And the hub also lets to help us with this switching between transportation means, between air transportation to ocean transportation in order, let's say, to create a less air-intensive distribution network for LATAM, which is also an important goal from a cost efficiency perspective, okay? An additional idea is try to leverage the regional supply. Production of vaccines can be increasing even in Brazil or Argentina in order to increase, the availability into the region. Remember that most of the suppliers, 80% mostly of the supply force is located overseas. So if we can bring them to the region, of course, we're winning in different ways. So also that element is also a big challenge, to do. And of course, but also bring us interesting opportunities to improve our logistics operation. But in order to do that, we need to come up with a really important approach. Getting a hub in operation, taking consolidation opportunities. That means we need, let's say, to talk with everyone that is involved in that distribution network, from suppliers, pharmaceutical labs, even from countries, but also, and PAHO also is doing an interesting work on try to establish a communication between them. But there is a word that must be understood perfectly: collaboration, okay? We need to come up with collaboration if we want to do that. For instance, the whole Caribbean countries can collaborate, on create a better procurement platform for placing orders in a better way, not so spread among the time, for instance. So that means collaboration. In the previous conference, precisely, the speakers was talking about that, and also they already showed to us an example of collaboration in the ports and how this element helps a lot the region, the Caribbean region. So we're talking about the same things. That means we need to change our governance model. We need to adapt it to this new, let's say, way to work. And that's quite important if we want to, let's say, improve our logistics. But keep in mind this, the only way to improve the logistics from a cost perspective, if we consider, the possibility of breaking paradigms. For instance, it is possible to transport vaccines by ocean. Why not? Okay? So we need to think differently. We need to ask ourselves, if we can do the things differently in a different way, if we can break those paradigms that probably in the past was quite difficult to handle it. So that is the message. Collaborations, things different logistics. There is no other way to achieve this efficiency. And in order to come up with all of the things, we must be innovative. That's why we need to open the door, to see different alternatives for getting a better logistics for the region. At the end, as you already saw it in the previous slide, who is paying the logistics price at the end? The government? No. The people at the end. So we are working for whom? So we need to understand that. And if we understand that, we can improve the logistics in a really impressive way. But we must be innovative. That is the call I'm going to give you today. Thank you, Daniel.
Thank you, Enrique. Yeah, so many opportunities, and just for example, on the consolidation of orders for the Caribbean islands. So the revolving fund has a facility of credit line. So Dominica has access to the credit line. So while we have the opportunity here to approve Dominica, Barbados, and all the islands, their credit line according to their demand plan for this year, for example, then have the opportunity and the flexibility to place the orders at the same time for the same vaccine from the same manufacturer. So there are so many opportunities, but in order to move forward, how can we translate this into a strategy, Carsten? It's beyond logistics. There are other components that has to be into a strategy.
Yeah, no, thank you, Daniel. So building on that, PAHO actually took that step and took that leadership action by really showcasing what can be done in this space. Just to give some context, so in the UN system itself has been reporting on what we call greening the blue, which is technically scope 1, 2, and category 3.6, your business travel. And that has been the limit, or the boundaries, if you wish, of emissions reduction calculation and reporting within the UN system. Now, the new sustainability management strategy of the UN system 2020 to 2030 is expanding that scope and saying, no, you need to include all aspects of your work, including procurement and supply chain, which means now that the UN system is required to start looking into their scope 3, like all other companies and institutions. So on that background and in that context, PAHO actually decided to take this vision forward with the PAHO Scope 3.4 supply chain emission reduction strategy, following the GHG protocol for how to measure Scope 3.4, which is your upstream distribution and transportation activities. So this really started with a baseline, and this is where everybody should start, right? Every organization, every institution should have visibility on their baseline. What is your current footprint? And as you calculate that, you will also find opportunities, hotspots. Where's the biggest impact areas? As we referenced before, 95% of the footprint for these 3,000 shipments from this particular fund comes from this transport element of the port of origin to the port of destination. This is a level of visibility that allows you to action and to build meaningful strategies. So the baseline was done. And the next stage, according to the GHG protocol guidance on this, is supplier engagement. Now, what does that really mean? And I think it was with some hesitation that we went out to the suppliers. We're talking big pharma mostly, right, for PAHO's portfolio. How would they react to that? What would their response be? And I have to share that this was probably one of the most positive and constructive conversations we've had. All the companies that we reached out to responded positively by coming up with ideas, by saying, okay, so this is what you want to do. You want to have your emissions by 2030. This is what we could do. This is what we're already doing. Maybe we could collaborate on this and that. And that was an enormously interesting and very positive finding, actually. This allowed us to set targets, to go into PAHO's portfolio, their shipment activities, and develop some meaningful, realistic targets on how they could reduce their GHG footprint in this space by 50% by 2030. Short-term, medium, long-term meaning 2030. So we were able to break that down and develop these strategies. And this is what you see on the slide here. So basically 5 main entry points. The first one at the product level, like scope 3.1, the product level, really trying to gauge what is the current sustainability activities from the suppliers themselves, initially asking them to share their sustainability reports, their own targets. Are they aligned with the Science-Based Target Initiative, et cetera, gauging what is the current maturity of the supply base in terms of sustainability action. The next one is then to see, okay, is there a basis now for increasing the demand? Say, you actually need to set targets and so on as you move through that strategic entry point. The second one, and I think the one that we realized was the most impactful, is promoting the modal shift to low-emission transportation options. That sounds very high level, but basically, the biggest impact would be if PAHO was able to transition from air shipments to sea shipments. So currently 60% of the portfolio is by air and 40% by sea, because vaccines by definition to WHO regulations and so on, it's temperature controlled, it's sensitive, short shelf life, etc. So there's been this sort of notion of requirement that you have to ship it by air. But to Enrique's point, if you innovate, it is actually, and this is some of the feedback we got from the suppliers, we're already doing this. We're already looking at how we can transport vaccines by sea using reefer containers, et cetera, setting up the right distribution system with cooling facilities. And this was a great opportunity. We calculated, actually, that if PAHO was able to switch entirely all the activities from air to sea, they would reduce their emission footprint by 98.6%. That should wake everybody up, right? We're looking at how can we get to 50? 98.6%. That's, of course, not realistic. You can't do a whole total 100% modal shift, but it gives you an idea of the opportunity. And this is basically what entry point number 2 is about. 3, as I mentioned, reducing packaging and promoting sustainable material use. Reducing the package is part of the GHG calculation equation. So if you reduce the packaging, suddenly you get a lower GHG footprint. I said, okay, well, you can't do that. This is all governed by protocol. Things will get messed up and destroyed. There'll be loss and so on. Actually, one of the suppliers immediately, within 48 hours, came back to us and said, hey, by the way, we thought about what you were saying about packaging. We believe we can reduce it by 30% within a year. 30% of the weight. That's, of course, not across the board, but this is a good example, again, of what Enrique is saying. Innovation, think outside the box, think about how we can change how we do things. Finally, enhancing shipping consolidation in PAHO supply chain. This is, of course, Enrico and the team's project about how can you optimize your supply chain, because with that comes a corresponding emission reduction. So there's actually co-alignment, which is going to be our big message here, between optimizing your supply chain, saving money, and saving emissions. Because less activities, less distance, the more efficient your supply chain is in terms of cost, the more efficient it also is on emissions. So it's a component of that, which I think is quite interesting. Finally, and more aspirational, leveraging low-emission transportation solutions. So for those of you who sat in on the morning sessions in the A stream next door, would have heard a lot about methanol and ammonia solutions and so on. Is it possible to use sustainable marine fuels for, let's say, an organization like PAHO? Yes, it is. And actually, she left Ines, she was just giving me the latest rates on methanol versus fossil fuel. But we're expecting that the methanol rates, for instance, will be pretty close to fossil fuel by 2030. Meaning, if we can be part of that transition, there is GHG emission saving even on the sea shipment. Let's see about sustainable airline fuels, which is taking a little bit longer, but the biofuels and so on is being introduced in that space. But even in marine shipments. Part of that strategy, actually, PAHO is working with the Maersk Center for Zero Carbon Shipping, exploring what are the opportunities for leveraging things like the book and claim. the book and claim framework, which is amazing, innovative tool and platform that the Maersk Institute is putting together. You may not know them, but they're actually a collaborative space, so collaboration. 50 plus shipping actors or stakeholders, whether it's the carriers or the shipyards themselves, are collaborating in a common center to find solutions on how they can facilitate this energy transition within the shipping industry. And they've come up with this book and claim platform, which basically allows you to mobilize demand. Because one of the biggest issue now is, of course, okay, if I invest in a methanol ship, which there's 211 currently out of 140,000 vessels operating, it's very small, right? Do I have the supporting infrastructure? If I'm going to develop methanol and so on, do I have guarantees for offtake and so on? But this platform allows you to actually go in and buy tokens as if you had been shipping with methanol to an actual methanol ship that might be sailing on a different route, but the same distance with the same fuel consumption and so on. So this is part of these initiatives that we can support to build demand for this transition to take place. So, these were the 5 entry points, Daniel. Sorry.
A lot of solutions, a lot of opportunities, but I think the most important opportunities on the emissions and savings is transitioning from air transportation to ocean. And sometimes when we go to a member state and say about emissions, they pay some attention, but when we say savings, it's more attention, right? It's money. And this is, I think, a nice example on comparing the same product, the same origin to destination, comparing air transportation with ocean transportation. So
there's nothing as powerful, right, as a real case study. So this is real. We didn't put actually the port of destination in here. We anonymized the case, but it's real. All right. So here we have a product. It's an antiviral. Port of origin, New Delhi, India. Port of destination somewhere in South America. 27 tons shipped. So the original shipment was based on 6 deliveries by air. And we broke down the calculation, you can see, and we compared that to a consolidated, fully loaded container in one shipment. So we can achieve what Enrico is saying. Can we consolidate? Can we standardize and so on? We could have this sea shipment consolidated and sent by sea. And as I said, nothing as powerful as figures, right? So in comparison, the air shipment, in order for you to offset that, would require you to plant 23,941 trees. That's a lot of trees, compared to 395 trees if you had just put it in a container and shipped it by sea. Similar, it's equal by air, the full emission of 114 cars driving for one whole year versus 2 cars driving 1 year. So the comparison is enormous in terms of the emissions, right? But who cares about emissions? We want to talk about the cost savings, right? Cost savings, well, $280,000 to ship this by air versus $13,500. This is like a no-brainer, right? You save money and you save emission. So who wouldn't want to save $267,000 and $267,300. Sorry, I did the calculation here. That's a lot of money to save. And to your point, who benefits from that? That's, of course, the end user, the population, the taxpayers at the end of the day. So it's really important to make these kind of calculations to get that message across that emission saving actually co-aligns often with cost saving, which makes it a much more appealing package to take forward to governments, etc. Just to mention that, by the way, these 3,000 shipments represent roughly about 50,000 tons of CO2 equivalent, which if you were to offset it, and we compared this many ways of offsetting. This is a project in Nicaragua, just to be regional, $45 a ton equals $2 million worth of offsetting costs. So if we start, like the gentleman mentioned when he closed yesterday, next door, he said, what if we introduce carbon tax, a carbon cost? Suddenly, you start monetizing this invisible cost, and suddenly it becomes a $2 million liability for an organization. That's powerful. Numbers speak their own language, right? So really, it's all about now collaboration. It's about establishing the right infrastructure to support this. Because, of course, if it was so easy, everybody would have already done it, because everybody wants to save $267,300. But these are the challenges that we've been discussing so far, right? You need the supporting infrastructure, but they're usually small things when we ask into why did you decide to fly it by air? It's very different from each country, by the way. It could be, you know what, our port is not efficient. If we send it by sea, it'll be stuck in port for maybe 8 weeks, and we have clearance issues, we have demurrage charges. There's no facilities if it needs to be temperature controlled, etc. Some say we actually didn't budget for the amount of clearing it in the port. It's a minor amount of money, but it's actually easier from a budget perspective to ship it by air, which is a whole different angle. Others say, well, for security reasons, we ship it by air, so because we can't transport it by road, or the water levels in the seaports are too low. There's all sorts of very practical reasons why this is generally not done. But I think the numbers speak for themselves, right? The huge amount of money that can be saved and the huge amount of emissions that can be saved with this transition really is important. The last point, I just want to say that, there's a lot of talk about infrastructure, right? We've a lot of IDB, World Bank, people here talking about infrastructure projects and so on. And that's great. That's important. It's part of this transition. But there's another piece of infrastructure which I think is equally important, and that is the digital infrastructure. So Enrique mentioned that in order to fully leverage this optimization opportunity, you need to manage demand. And that's really the key here. If we can manage demand, if we can consolidate, if we have that digital infrastructure that is across the member states, I would guess in this case, it would really facilitate both cost saving and emission saving. So digital infrastructure is equally important to physical infrastructure, in my view, in this case. Thank you.
No, thank you, Karsten. Yes, because in order to accept the longer lead time on transit, let's say 4 weeks, you need to manage better inventories and so on. So, to achieve these savings, we'll need to change the way we operate with member states on demand planning, on many things, inventory management. So I think opportunities ahead, but we need to tackle those challenges. So I would like to ask the Honorable Edwards about how do you resonate with this type of solutions not only from the perspective of Dominica, but for the Caribbean and in the region.
I think pooled procurement would be a very good solution to this problem. At least it would have helped in solving some of the issues, because with pooled procurement, first of all, the unit cost would be reduced, like it's done at the OCS PPS. There is a pooled procurement going on at the OCS PPS, where the OCS islands combined, and they all buy their medicines together. And one is pooled at the OCS PPS at St. Lucia, and it is distributed to various countries. And the unit cost, obviously, would be reduced because of the volume. Because as my friend just said earlier on, if each island have to buy their own individually, small amounts, it would be more costly. So I think that would be a very good thing, and it will also cut down on the administration burden of the various islands, because it is done as a collective. So I think we should look in that direction in terms of our vaccines as well. If we could do that, it would help. And the hub is very important. We cannot overemphasize it. I know we are fatigued of hearing it, but we have to continue saying it. A hub is very important, that we could come as a hub and do everything together as one, and collaboration is the main word, as we always say. And we heard it yesterday, we heard it this morning, and we are hearing it now again, and we'll hear it tomorrow. Collaboration, collaboration, collaboration.
No, thank you. And talking about collaboration, I would like to share a story. So I've been in the vaccine arena for 14 years now. Wow, time flies. Same with the colleagues. And 18 months ago, one of our suppliers, who is based in Europe, told us about the idea of moving vaccines by ocean. And I replied back like, no. Lead times, cold chain disruptions, like, we say no. And they say, well, we are going to do it anyways, because we need to serve the private sector, the private market in Latin America. And they have hubs, one in Uruguay and another in Panama. And okay, so it's your choice, but not for PAHO. 18 months later, so today, we are fully convinced a paradigm has been broken. Because so far, they have mobilized for the revolving fund for 14 countries, they have mobilized more than 1.2 million doses of vaccines. The trick here is that they agree with the regulatory agency that while the vaccine is, instead of the vaccine being sitting in Belgium for the regulatory agencies to clear for exports, there was an agreement to do the process while the vaccine is being prepositioned by ocean to Uruguay or Panama. So the impact in lead time there's no impact on lead time. So as soon as the vaccine is clear for export from the regulatory agency, they are able to ship from Uruguay to South America or from Panama to Caribbean and to Central America. So far, there has been a reduction of CO2 emissions of 40% and savings in the logistics for member states of 30%. So this type of collaboration is needed, like thinking out of the box, breaking paradigms, doing pilots, and also now the reefer technology is more reliable, and also they requested WHO to assess the conditions of moving vaccines by ocean. So it's a matter of collaboration, regulatory agencies, private sector, so the manufacturer, PAHO, governments. So it's a matter of collaboration, and it's something that gives us, good, positive energy to continue on adopting these new ways of operating. But we would love to listen the audience, because maybe you relate with similar challenges and solutions for your industries, and happy to take any question that you have. So please.
I have a question regarding, I think, Hansen mentioned, the digital infrastructure, because you try to optimize the transportation model and also the road. Theoretically, this can be done by AI or algorithm, but I think the question is that are the data in the market or the algorithm in the market can be trusted, or so my general question is that I think the technology is there, but the solution is still not yet, right?
Okay.
Yeah, please.
Okay, let me take the question first, and then over to Danielle. So what we really need is good old-fashioned demand planning and demand management. This allows you to optimize your supply chain, and by optimization, you're able to choose a lower emission transportation mode. Currently, when we have stockouts, what do? You get it flown in, right? You cannot take the risk of having things delayed by sea or stuck in the port, so you automatically go for an air shipment. So better inventory management at the member state side, better planning and then consolidation would allow us to have more optimized supply chain, and as a consequence, simply better or lower emissions. So that's really the data we need. We need that from the requisitioners.
Are you able to anticipate how much is the risk for delay or for disruption if you take the ocean road?
Sure.
So this can be
So let's say,
AI
yeah, of course. Of course, AI can do everything better than us, right? But in this case, you can easily say, look, I'm going to ship the 20% by air, and the remaining 80% will come by sea. That gives me a 3-month buffer for my sea shipment to arrive comfortably, and I'm okay with that. It's just a way of thinking. So really, a big part of this is awareness. It's about integrating that awareness into the decision-making process of all the people in the chain. And if they are aware what your decisions actually cost in terms of money, in terms of emissions, and there's alignment between the incentives of those people taking those decisions, then you have a better outcome. If you're in charge of, let's say, vaccines or, let's say, syringes supply, to keep it simple, right, and you're seeing a stock out, but you're not the budget holder, you're not responsible ultimately for the overall budget itself, you're more concerned about not being held accountable for a stock out on syringes. So you will take the decision flying by air, right, because you don't want to take the risk, as you said, right? But if you have alignment between the decision-making and the budgets and all these other factors, then you have a much better outcome. So,
just to complement, I, in my previous experience in PAHO, I developed the demand planning tool for vaccines. And I know that is not the right fit for all these strategies, because we have a platform for demand planning with member states, but it's not synchronized with lead times, with shipment in orders. And there are tools out there in the market that do this, continuously reviewing all these with AI, continuously reviewing lead times, inventories, stocks, and suggesting when to place orders, in what quantities. So that's one of the actions we should do. Let's explore those platforms so we can have a better reliability on the moment we place orders, in what quantities and for what countries. So that technology is needed to implement all these solutions. But great point, thank you.
Yes. Hello? Yes. Going back to the sample case that you just shared, I just wanted to know what the impact would be on warehousing. Because if you split the deliveries in 6 and then you go to 1, this will have a definite impact on your warehousing. So basically, what is the domino effect on warehousing?
Yeah, great question. In this case, so it's the same 540,000 bottles. It's the same. You see there 6 deliveries is because of the air cargo capacity. And that happens when we move vaccines from Korea. There's maximum 250,000 doses, for example. So we have to split, in this case, the 540,000 bottles into the 6 deliveries. So on warehouse space, is the same. It's the same quantity. However, to move to sea transportation, member states will need to consider more, stock reach, right? More stock levels. It's something that we will need to work with the governments, but also I think savings of it's a lot of savings could justify maybe to move a couple of products, high volume products, partially by ocean. So that's the next step, to do those concrete business cases with few member states. We have 5 countries identified in order to implement all this strategy that we just established.
Let me add in some element. According with our modeling element, and we already took into account warehousing costs in our, let's say, network configuration modeling. And the warehousing cost is not the driver from the logistics costs, not at all. And we already got some elements, taking into account different facility locations in Panama, Miami, or even in Barbados. And that warehousing element, of course, we already took into account, but it's not as important the transportation cost. So any savings in transportation will also cover, let's say, any increment on warehousing cost as well. So this is also important to know. And also, we already, let's say, be confident with our modeling strategy in that way, because we are considering different elements. We are analyzing that at that point. There is an interesting strategy, for avoiding risks, and it's getting information before. That's why, using modeling algorithms and everything related with that is helping us to get information before. So we are taking advantage also from that point of view.
So no, thank you. And I think great insights on the challenges, but also on the solutions. I think we are working for the people. I like the message yesterday where it's a forum of supply chain, but at the end, it's a forum of people, right? If we are efficient on the logistics, we pay less for the cost. So the governments can, do those, use those savings to increase health coverage. There are many needs, and our member states, they procure all these products with their own government funds. The very minimum are funded by donors. And so we have the strategy in place, but there are two keywords in order to move forward with the strategy. One is innovation, and second, collaboration. So innovation, we'll need to think how we do the logistics, all the solutions that this panel have shared with us. We need to rethink in our technologies. We need to rethink on the way we move the vaccines, partially by ocean, even the syringes, preposition stocks. So many opportunities for innovation, and also leverage regional production, which is something we are doing. We're increasing capacities from Argentina and Brazil of influenza vaccine. But collaboration, everything is impossible without collaboration from governments, not only the Ministry of Health, but also customs, for example, when we do the mapping of what are the bottlenecks of not receiving syringes by ocean. We need to continue collaboration with the public sector, with the manufacturers, such as this based in Europe. So do innovation. There are other competitors that, hey, let's do the same. So we need to continue that collaboration with the agencies, UN agencies, and also the regional integration organizations to find common opportunities to collaborate. And lastly, with financial institutions, we will need investments, not only on digital platforms, but also support to do, deep assessments with member states. So PAHO, as the health platform for the Americas, is ready, to provide that collaboration, to have that platform for collaboration and to showcase all these initiatives, these solutions. So thank you so much for the participation in this panel, and so thank you. And something I miss, so the vision here is not only to keep protecting the health of the people, but also the planet. And we can do it with this strategy. Thank you.